Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today, I am excited to have as my guest Dr. Arash Hakhamian. Dr. Arash's career has involved multi-practice ownership, starting multiple teaching institutions, volunteer organizations, and award-winning companies. He's been a dentist for the Saudi royal family, as well as the Special Olympics. He currently runs the largest virtual DSO in the United States. His company, Dentulu, was awarded the Oscars of Dentistry with back-to-back Celerant Best of Class Technology Awards at the American Dental Association, generally disrupting the way dentistry is being delivered. Dr. Arash is currently working on a revolutionary new product that has promising hopes of curing dental cavities, gum disease, and candida through a prebiotic. Welcome to the podcast, Doctor.
Wow, thank you. What quite an introduction.
Yes.
That's nice.
And
Nice.
the only thing we didn't mention is your pre-knighthood status, but we know we are en route to that.
That's funny. That's funny. Well, thank you. I really appreciate it, Matthew, for having me on. And hi, everyone. Glad to be here with you.
Yeah, well, thank you. I've been looking forward to this conversation and having a little bit of fun. We've already had a little bit of fun, so
yes, we have.
We can carry that on into this part. So since this is the Truth Behind Dentistry podcast, I'd love for you to share some truths with us, and maybe we can start with maybe some opportunities, trends, or changes that you see influencing hygienists and other dental staff, maybe as a place to begin.
Yeah, thank you for that introduction. But just for some context, I guess, so people know what I guess some of those things meant. So I come from a line of dental professionals. My family's full of dentists and hygienists. I have owned and operated a bunch of brick and mortar dental offices. But one of the things I've loved doing forever and ever was mobile dentistry. And I was a mobile dentist, and I treated some of the Saudi royal family and a lot of the entertainment and royal families here in Beverly Hills. But the best part of it was doing this in really underserved communities in Guatemala or for the Special Olympics and setting up these mobile programs. So I have a tremendous amount of respect for hygienists and RDHAPs, and I love the technology stuff. And I felt like there's so many cool technologies coming to the market, and one of them was just like all the Uberization of stuff, like mobile apps and AI. And so about 5 years ago, we decided to ditch the brick and mortar offices and go mobile with an app that's kind of like Uber, but for dentistry, right? So all these mobile hygienists and mobile dentists and RDHAPs can actually go to people's homes, and we would set up the software for it. And so we teamed up with Google. We created a company called Dentulu, and Dentulu was the Uber of dentistry, where all the mobile hygienists, all the mobile dentists can create a free account and use mobile, Dentulu software to find clients, and we would take care of all the logistics stuff. So think of Dentulu like Uber, and the hygienists can now connect with people who want them and go do their services. So when the pandemic hit, the mobile stuff just kind of went away for a while. It was like everything was shut down, and we certainly were afraid to go into people's homes. So we focused a lot more on the teledentistry side, the telemedicine, virtual consults. And that got so big, we've never gone back to the mobile ourselves. We still do support all the hygienists and mobile clinicians, and we give out our software so they can use it. But we're very much into the tele world. And as such, we see all types of new innovative stuff coming to market that can be incorporated into at-home dentistry, into early prevention, reaching patients where they're located. And so to answer your question, there are so many cool things coming out to market that are going to completely change dentistry.
I love it.
Which is why I'm so excited and passionate about what we're doing.
Yeah.
I think the next 5 years in dentistry is going to completely turn dentistry upside down with things like anti-cavity mouthwashes, anti-cavity mints that can now stop cavities just by taking a mint, and artificial intelligence. These type of things are coming to the market really hard. They're already here, believe it or not. But by the time they actually hit the dental offices, there's usually a lag of 5 to 10 years.
Right, right.
So I'll share with you a couple of things that are available today.
Okay, cool.
But you probably won't hear about them in your dental office probably for another 5 years at least. So where should we start? You want to start with AI? Like, where do you want to start?
Well, I think that sounds like a cool place to begin. And it just makes me think about how difficult it is to turn anything upside down, right? And revolutionize, because there are forces that resist that, right? And I think dentistry is one of those where historically things have been done a certain way. And that's the world view that such a large number of people have, and there's vested interests, right, in keeping things certain ways. So I'm always intrigued by, even in a world that's rapidly changing, how many things are holding back possibilities. So whenever there's success stories of breakthroughs and pioneer people, like I see you being one of those, which is another pre-knighthood, I think, qualification, right? That, I love to hear what you're working on in some of those things. So yeah, start with AI and let's roll from there.
Let me tell people why you keep bringing that. So one of my friends, Dr. Bill Dorfman, he's now officially a knight. I was at Bill's office yesterday, and he had a plaque on his wall, and I was like, "What is it?" He's like, "I was dubbed as an official knight by the Queen." So Matthew and I were talking about the day we'll finally get dubbed.
Right.
So, there's this thing I love to talk about. And because I'm not in the clinical chair anymore, I get to now go out and have fun with all these toys that are coming out to market. So one of the things I'm noticing is this curve of innovation. And so it starts off kind of slow, and then it starts to go up. And then once it's kind of going up, it just goes hyperbolic.
Mm-hmm.
So like artificial intelligence, at first it's not so intelligent, right? So it starts learning, and then it learns to teach itself, and then it just teaches itself faster than we humans can ever teach it. And this just goes crazy, even beyond our ability to understand.
Mm-hmm.
In fact, there was an example I think they had talked about a few months ago. One of these artificial intelligence platforms within minutes taught itself another language, and they had to shut it off because they didn't know what it was even saying, or what. It was like light years ahead already. So you see these very disruptive technologies come to dentistry, and it just starts to cause this massive chain reaction. And so I'll give you an example of one company called Dentally Tech. Dentally Tech is a company based out of Israel they're the ones who developed the cameras for our cell phones. Okay. They're the ones who developed the facial recognition. So these guys figured out how to take these cameras and create a different type of intraoral scanner, an easier scanner, a better scanner, a cheaper scanner that doesn't require these heavy, form factors. So they've developed two different types of scanners. One is a scanner that has a periodontal probe at the end. So now when we are probing, we are also charting, and we are also scanning. So when you are taking instead of taking an initial impression, you take an initial scan, and at the end, you actually use that same scanner to also probe. Now, this probe can see underneath the gums. So we're getting consistent, standardized probing depths, and it's able to visually show us where calculus is located underneath the gums. It's able to show us where we have bleeding. It's able to show us visually if there are cracks and open margins and abfractions, and just really cool next level stuff. So we're actually standardizing periodontal charting. And at the same time, it's standardizing restorative charting. So where's this going to go into the future? Well, we don't have to argue about what the probing depths were anymore, because we now know visually what the probing depths are, and it's standardized from one person to the next. So insurance companies will have to approve the ones that are 4s and 5s, and they can't say, well, it looks like 2s and 3s to us.
Right.
And then dentists and hygienists can't make a 2 or a 3, a 5 and a 6 now, just to get that case approved.
Right.
But I think more importantly, it allows us to visualize what it is that's going on underneath. And it allows our patients to actually see what we're talking about in terms of bone loss, attachment loss, cracks. And so I'm very excited about Dentally-Tech, and I have recently worked with them because they have invented another very cool scanner which attaches to your cell phone. And you heard that correctly. Dentally-Tech has created something called the Digilight. It is the first attachment that goes on your camera, and you literally take your camera, your phone at home, and you put this attachment and scan your mouth. And by doing so, you get a full STL file at home of the entire oral cavity. So if your patient loses his or her retainer, they can just take a full scan, and at the office, you can just print it for them and they can come pick it up. Or better yet, you could just send it to them. So the idea of being able to track our patients over time and see their wear patterns, see their periodontal health, see early signs of cavities and gum disease. It's now all able on just a cell phone. So this is turned into a diagnostic tool in many ways. And so I think that's cool stuff. Between the at-home and in-office, Dentally-Tech is one of those companies to look out for that I think is going to revolutionize the dental industry, artificial intelligence, and the scanning industry for sure.
Wow. Yeah, that's incredible. And I remember when I first heard about teledentistry, I'm thinking, well, like, how much can be done? And it's like, well, what sort of advice can you give? What sort of history can you? But all of these things, the way the world is going and these technological advances, it clearly changes what's possible from a tele-vantage point, right? And then I'm curious as to how you see those technological breakthroughs then connecting into corrective, preventative, proactive approaches, like as you were talking about mints and things like that, to be able to, without coming into the office, to be able, like, once certain of those diagnostic conclusions are drawn, how far do you see this going in terms of what people can do to have some degree of restoration, recovery, and prevention flow from those really cool tech innovations?
So I look at, and I hate the word teledentistry. In fact, I don't even use the word teledentistry anymore, but let's just use it because you brought it up. But it is dentistry to me.
Right.
So a company out there, a small old company called Smile Direct Club, decided to do clear aligners at home. They try to make clear aligners convenient and accessible and affordable for a lot of people. Now, it's very controversial. Moving teeth without getting the person in for an exam and checking, the occlusion and x-rays, it may not be my cup of tea.
Right.
But there was an overwhelming response by the consumers that said, I like this. I'm nervous when I go to the dental office. Right. I'm scared to go in. And it's also very expensive. And also, I have work. I have to miss work and sit in traffic and come to the office. And, the last statistic I heard was that 164 million work hours are lost every year going to the dental office for basic procedures, exams, checkups, routine procedures. That 164 million work hours that is lost translates into billions of dollars of lost income for businesses.
Right.
it's a huge burden on society. Now, you're going in to get dental work, right? Which is very important to me. I think that your oral health is the determinant of your overall health. So I think this is a great time to be a dentist and a dental hygienist specifically because our work saves lives. Mm-hmm. It's not about teeth anymore. It's about healthy lives. Mm-hmm. You don't want Alzheimer's, dementia. You don't want to have problems with fertility, birth, premature birth, in vitro fertilization, cancer, bacterial endocarditis. Make sure you have clean teeth, right? So there's no better time to be a dental professional than today. And we got to talk about this stuff. But when we've been talking about prevention for how long now? Since you probably were in high school, we've been talking about prevention. Since my father was practicing, I've heard prevention. Well, prevention is very rarely going to occur in the dental office.
Right.
We both know that by the time these patients actually come to the dental office, they already have incipient lesions, inflammation. We're just measuring the disease that has already occurred.
Right.
And now we're trying to restore them back to health. So very rarely are we actively involved in prevention at the dental office. And that, the added bonus is that insurance carriers don't pay us to focus on prevention.
Right.
We don't heal, we restore.
Right.
So teledentistry, which is dentistry, goes beyond video conferencing and talking to people. This is an opportunity to actually treat people. And I don't do clear aligners, but I'll tell you, I do tons of salivary testing at home, which I feel perfectly comfortable doing. I can check people's saliva through oral DNA or through companies like Viome or HR5 or Bristle, or whoever I want to use. I check their saliva and I can see if they have imbalances in their oral microbiome. Mm-hmm. And I can also see their teeth. So there are cameras like this mouth cam, which is like $30, $40 mouth cam. I give these to the patients and I can see their teeth. I can take pictures and photos and I can do it live and do an evaluation in real time.
Awesome.
So I can see their saliva. I can see just like a blood test at a physician, we can see stuff in their saliva. We can see their teeth. And there's another company called Pearl that actually does artificial intelligence, FDA approved. So any kind of x-rays that are sent, Pearl will evaluate them and tell you if they have early decay, incipient lesions. So we can have a patient at home. None of this stuff requires in-person visits. We take a saliva test. We then do an intraoral exam. We have their chart and x-rays uploaded by a dentist, whoever their last dentist was, into their chart. And this is all done at home. Now, I can tell you that I feel completely comfortable screening that patient as a high-risk cavity patient. I can feel comfortable saying, hey, it looks like you have gum inflammation. It looks like you have calculus buildup. It looks like you have abfractions or attrition. So from there, we have now treatment options. We can actually say, hey, as a high cavity index patient, we would love to put you in a remineralization tray. We would like to make you a custom tray from PerioProtect, and we would like to use that for periodontal disease and double it as a remineralization tray. So in the morning, you use PerioProtect's trays and you use their gel, and in the afternoon, you use MI paste or any number of remineralization pastes. So that's way beyond just video conferencing.
Right.
We're talking about early prevention. We're talking about minimally invasive dentistry. We're talking about reversing disease. And all that is done, no pain, no shots, no drilling, all done at home. So you ask, how do you take impressions at home? Well, two ways. We have impression kits just like Smile Direct Club. We send it to the patient's home and we get beautiful impressions taken at home. And now Dentally Tech has this, the Digilite, which now allows us to take digital scans at home. So now we can use a digital scan at home, and we have your x-rays, and we have your saliva tests, and we have all these things. So we can now make you, remineralization trays, perio trays, retainers. We have a partnership with a company, maybe you guys have heard of this company called Valplast that makes flexible partial dentures. So they work with a company called Reset Smiles that actually does tooth replacement at home. So now anyone who's missing a couple of teeth and maybe can't afford dental implants, or they're going through a period of time where they're saving, but they still want teeth to chew on, well, I have no problem making you a temporary removable prosthesis until you can get that permanent solution. So teledentistry is an archaic word for me.
Right.
We do virtual dentistry,
right,
and
right.
we do at-home dentistry.
Right.
And these are just some of the companies that we work with. And some of the insurance companies we work with, like Anthem, that has 48 million members, with whom we work to do at-home dentures and denture duplication through a lab called Avident. So we're doing tooth replacement, dentures, partials, night guards. And so there's actual legitimate treatment that we can do. And the things that we can't do, we talk to these patients and we explain to them that the importance of going to see a dentist and a hygienist for in-person care. And so we push them towards going into the dental offices to seek treatment. And sometimes we require them to see an in-person dentist first to get a clearance, so they can then get some of the services in a convenient fashion at home. Wow. So that's teledentistry, and that's really what Dentulu does, is expand dentistry outside of the brick and mortar chair and touch millions of lives, whether they're disabled, they're Alzheimer's dementia patients, they're geriatric patients, or they're just busy. And they just can't make it to work. And so that's where dentistry is going, and we're using all of these emerging technologies to push dentistry in the direction of real preventative dentistry, and utilizing teledentistry as a tool with which we can provide care.
Yeah, so there's more than one. There's multiple elements to this. So part of this is what all you can do while somebody's at home, what all you can do virtually from a diagnostic standpoint, but then also it's not the same thing with what you can do from a I guess some parts of that being restorative, corrective to the oral microbiome, et cetera, but also to be proactive and be preventative is really kind of another piece. They're related, but those are separate things. The ability to diagnose from home and the ability to actually improve health on an oral systemic basis, right? So you're kind of marrying those elements together. Kind of makes me curious about how much dentistry, like what percentage of dentistry actually can be done from a virtual perspective. And then it makes me think, how do dentists in the coming years remain as equally relevant and a part of all of these changes that are possible? What does that mean for dental careers? And for those even listening right now, the doctors listening, and maybe also how does this relate to the hygienists listening? What does this mean for career shifting to kind of still be riding the crest of the wave rather than the wave landing on anybody's heads moving forward?
Well, this is probably one of the best opportunities for dentists to capitalize on this wave. So get your surfer boards out, because let me tell you, hygienists now for the first time can really scale a hygiene business, have true independence, and be able to start a mobile practice providing on-site care. So you want to pick the days and hours you want to choose. You don't need to work in a brick and mortar setting anymore. You can start your own mobile practice, whether you have your RDH AP or not. Let me give you an example. Here in California, even if you are a regular, traditional, I hate to say regular, but traditional RDH, right? I have so much respect for hygienists, because they're the most important component of any good practice. And I tell patients, if your dentist doesn't have a hygienist, get a new dentist, because your dentist doesn't get it, right? But hygiene is so important. And imagine a mother of 5, 4, 3. Imagine the logistic challenges in getting these mothers to bring their kids out of school, take them to the dentist. 2 of them are screening in the waiting room. One of them wants mommy there when they're getting a cleaning. Like, it's a logistic nightmare, right? Or getting a babysitter to watch your kids. Well, what if a hygienist can just go to their house and pop open a chair that fits in your trunk and take your electric Profi handpiece and maybe your electric scaler? I mean, we were doing this. We were doing fillings and crowns and bridge. Now there's tons of hygienists doing this at home. So Dentulu allows you to now own your own business and operate your own business. Whether you still work in a traditional setting or not, you can now supplement that with an at-home service. And that's as a hygienist, right?
Right.
Or let's say you want to make money providing at-home oral hygiene instructions and reading the oral DNA tests and reviewing those results with the patient, or helping the patients through an impression. So they take a good impression. So when they send in their impression, so there's ways to make money.
Right.
And that's not limited to hygienists. Guess what? In order to deliver any of these services at home, we demand that it's done with the involvement of licensed dentists. We never go direct to consumer. We do dentistry under the supervision of dentists,
right,
and under the care of dentists. And we have dentists evaluate every single portion of the process, and they get paid. So our dentists don't bend over and look in people's mouths. They click buttons. So if you're a retiring dentist or a new graduate and you want to own your own virtual practice and make good money doing that, guess what? You can do that now. So you asked me earlier, where is this going? Well, it was interesting because I was at a trade show, and there's a robot now that can place implants for you, right? It's a robotic implant placement. And there are now crowns and bridges that are prefabricated. And so it's all controlled through a robot. Well, you could be sitting in the next room controlling that robot because you're seeing everything visually.
Right.
So in the future, a car will pull up, a truck will pull up outside your car. I'm sorry. A truck will pull up outside of your residence.
And
you'll step into
unless your residence is in the car, because you now live in your car. But anyway, go ahead.
That's a whole
that's
a whole nother story. Yeah, exactly. Well, that's a whole nother story. But seriously, like, I'm not talking about like foo-foo stuff. This is stuff that exists.
Right.
Currently, we have mobile CT scan companies that come by. They'll schedule an appointment. You walk outside. You take an intraoral scan. You take a CT scan. You take an FMX, and then they drive off. Now you got your full X-rays done and your scans done. So in the very near future, you're going to have a mobile truck that pulls up. It's going to have a robot in the back with a dental chair, and you're going to get in, and you're going to say hi to your dentist through the television, and they're going to say, are you ready to start your implants? And they'll place your implant through their little robotic hands, and you walk out and you go back inside. And that's the evolution of where dentistry is going. But today, we have thousands of dentists earning great wages, providing dental services remotely to patients in a safe and effective manner. And for dentists who still own brick and mortar offices, this is a great opportunity to extend the limitations of your practice and use teledentistry as a tool to go out there, and mobile dentistry to go out there and attract more patients to your office, and to do some of your post-op checks with teledentistry. So again, let's say you do implants or extractions or soft tissue grafts. Do you really want to pull your patient in to do a simple PO check and just check to see if the suture is healing? Well, why don't you just give them a camera and have them take a picture and evaluate the healing at home?
Right.
So dental offices have a huge opportunity to start doing a virtual first, evaluate and triage your patients, make sure they're qualified to come to your office, make sure they can financially afford your work, make sure it's a good fit, and then have them come into the office. And or you can work with companies like ours that do the virtual stuff. And then what we can't do, we refer to our network of offices, and we will send you pre-screened, pre-qualified patients who we've educated and empowered with even financing. We pre-qualify them financially, and then we refer them to a local office to get the cleanings and to get the surgeries and restorative care. And that's really an opportunity to expand your reach outside of your traditional marketing, and to get really high converting leads to your office and open up your chair to do actual restorative work and production, rather than wasting people's time having them come back for basic PO checks that can be done at home.
Yeah, I was just thinking of that in terms of scheduling and how the challenges of that, and for services that are not generating, any sort of profit margin for them. And also in my mind, I'm going to all those dentists who are currently struggling. You mentioned about like go somewhere else if they don't have a hygienist. I'm thinking about how many practices that I coach that are wrestling to try to find hygienists. So we've got this interesting shift going on with more opportunities for hygienists. And how does that interface with that brick and mortar location? And what are those opportunities? What's that going to look like in the years ahead to be a win for the doctors as well as a win for the hygienists? And the world has changed, right? Since the pandemic has made a lot of people question the models that they were using before. It creates new ways to consider things, but also people are struggling still with adapting to these changes, right? So if you were to say, given all that, if those listening and watching us would say, this seems right, I know I need to keep moving forward, whether I'm somebody who's been in practice for a long time, but I've still got some years ahead of me, or I'm earlier in my practice, but I'm not that familiar with this avenue. What would you invite people to do? What are some of the first steps it would make sense for them to make to move forward, to learn more, and to see how this could apply for their practice?
Yeah. My first motto in learning and continuing to grow is to listen twice as much as I talk. So we tend to go into these lectures, and it's not verbally talking, it's just self-talk. Right? Sometimes someone starts talking about something and you immediately lose interest because you're like, no, that's not going to work. And you don't even let them finish, right?
Right. Doesn't fit my worldview.
It doesn't fit. Yeah. So I've learned to just listen and just listen to what they have to say, digest it, and then evaluate it as a viable option or not. And maybe it's not an option today, but maybe it's an option for tomorrow. So never stop learning and never stop listening. And another thing that I think that get a second opinion on everything, right? Because oftentimes in my career, I did the exact opposite of what the masses were doing, right? The masses, I'll give you an example. When I graduated dental school, most people worked for a DSO or for another person. I just didn't do that. I said, I'm going to start my own practice. And there's some challenges there, right? I don't have money. And I'm in loan. I have debt and loans, but I figured out a way. I subleased a chair in someone's office and started my own practice, and I learned along the way. But I wasn't working as an associate. Now, there's platforms like Cloud that are phenomenal. They help you basically empower the clinicians to be able to choose their own schedule and to give themselves some time to be able to expand their own personal desires and maybe open up their own practice or open up their own business. So I would say try some of these things out. If you're working for an office, constantly bring the doctor some of these new ideas. And maybe they don't want to implement it, but they will allow you to do so. So like salivary testing is one of those things that should be a standard of care. A lot of dentists don't even understand the power of salivary diagnostics. But I do know a lot of hygienists that are going out there and actually implementing it.
Mm-hmm.
PerioProtect is another one of those, which I think it should be a standard of care. So that's one thing I would recommend. The other thing is something that I've done for as long as I can remember is I am a convention junkie. I go to every convention and I go booth to booth and I talk to the salespeople
Mm-hmm.
and I just listen. I'm like, tell me, why should I buy this?
Right.
What are you doing differently than everyone else?
Right.
What other applications of this are available? And so I'm able to learn a lot from the actual salespeople rather than some of the actual CE courses that are being offered. I take a tremendous amount of time to go booth to booth and speak to people and evaluate some of the possibilities of incorporating that into my business. And sometimes some of those conversations turn into me becoming an advisor, me becoming a KOL, me becoming sometimes an investor. I'm like, this is great.
Right.
Take at-home impressions with your phone. I'm all over that, right?
Right.
So I think you got to show up mentally and physically. Sometimes you got to just show up. So the weekends are great to have fun and party and relax, and that's certainly important to have life-work balance. But diamonds are made out of pressure, and sometimes you got to go through foregoing some of the fun activities, especially early on in your career when you can take risks. You got to put a little bit more time in and pay your dues and go out there and really expand your learning and expand your horizons and take some of those risks earlier on so that later on in your career, you're not starting, in your 50s all over again, trying to take risky moves. So not that you can't and not that you shouldn't, but show up. And if it's something that excites you, you don't have to force yourself to do it. You're going to enjoy the process. And you'll want to just go in there and learn more and dive deeper into something that makes you happy. So,
yeah, well, this is great. I'm fascinated by the conversation. I've learned a lot already just talking with you today. And it does help me understand why some people are calling you the Elon Musk of dentistry. So I think we have a basis for that designation. Maybe it's still pre-knighthood, but it's definitely
yeah.
It's definitely.
I'm honored. I'm so flattered to be compared to Elon Musk. I admire him, and I think that his mission is to change the world and make it a better place. And my world is dentistry, and I'm doing my own. I'm trying to change and improve people's lives through dentistry, and I think dentistry is so important. I love the fact that more and more information is coming about the oral systemic connection, about the effective impact of oral health on everything else. And so, as I mentioned, it's no longer about teeth and gums. It's about saving lives and bettering people's lives.
A much better mission and vision to hold, right? To be able to play at that level. And the Elon Musk thing, I think, makes sense because there's a broad diversity of territory that you are engaging in your work, as I'm increasingly understanding it, that it's not just one channel. You are looking at multiple channels in a sense, like Elon is for making a difference by integrating and taking a risk down a new pathway like he has done. So I admire that. And I think, so for those that I feel like we could talk forever, but probably shouldn't. So for those listening who are, I'm sure, still engaged, because what you're saying is, I think, very meaningful. If they want to get in touch with you, if they want to find out more about Dentulu, they want to find out more about what solutions you can have to offer for them, what's the best way to do that?
LinkedIn is a great place for me. My email is my first name, ARASH @dentulu.com.
Okay.
And I'm more than happy to make myself accessible to any clinician or future clinician who's watching this that wants to get involved in some of the progressive technologies and innovations that we're touching. And just like a dental office, Matthew, we have so many cool tools in dental offices, right? We have lasers and electric handpieces and this and that. Well, this new virtual office, this virtual practice requires cool tools and and technology. So it's been my unique pleasure to go out there and seek all these technologies and create a comprehensive virtual practice. And very soon, as of January, you guys will hear about Protectin, which is this prebiotic that was developed by a Stanford microbiologist that stops sugar metabolism. I saved the best for last. Okay. And so I'll talk about this briefly. Is we can now take a mint that is just a prebiotic. It's just very simple, organic, plant-derived. You can give it to pregnant patients. You can give it to kids. You can give it to seniors. You can even give it to your dogs, cats. It's completely safe and non-toxic, and it stops sugar metabolism. So it fools the bacteria into thinking that it is a sugar, and so they try to metabolize it, but guess what? They can't. And what it does is it stops karyogenic bacteria from being able to metabolize sugar and create acid. It also stops yeast from creating candida. So effectively, candida goes to zero. And it has a huge impact on periodontal pathogens. So huge emerging applications in endodontics, in surgery, in subgingival biofilm formation. So the name of the formula is called Protectin. Dentulu will carry this product, but you're going to see this in everything soon. And this is out of a company called Primal Health, and the doctor's name is Dr. Emily Stein out of Stanford. And NASA and the European Space Agency currently take these mints after they eat breakfast, lunch, and dinner. And so I think the very near future, Alzheimer's and dementia patients who don't brush and floss will be able to use these mints as an alternative to brushing and flossing. So I'm very, very thankful for the opportunity to share some of these things with your audience. And even more honored to talk with you, Sir Dr. Matthew Norton soon. but I honestly, I have a lot of respect for what you do and helping teams work well with each other and have a purpose behind what they're doing. And I think the work culture is something that is extremely important. So I'm very much commend you for all the work that you do, and look forward to the next opportunity to be here with the cloud users and viewers and share more on updates from Dentulu.
Awesome. Well, thank you for those kind words. And it's been my pleasure to have the conversation with you. And I look forward to further conversations, because I feel like there's so many other directions and specifics even that we could feel like we brushed the surface.
We'll have some fun together. Enjoy your holidays. And thank you again for having me on your show.
Thank you. And thanks everybody for listening. This has been the Truth Behind Dentistry podcast, Dr. Arash Hakhamian and Matthew Norton. And we look forward to seeing you next time. Thank you. Bye.
Bye, guys.
Okay.